I wanted to talk to you today about some really important information. Modeling done by the MetroHealth system suggests that peak for COVID-19 in Cuyahoga County may be significantly lower in the number of infections than originally expected, and that the county could see sustained impact driven by clusters of infections rather than a single large surge. The leadership of Governor DeWine, Dr. Atkin, and others have saved lives and radically altered the spread of coronavirus. The public distancing response is historic and has changed the trajectory of the infections from being driven by widespread communal transmissions. Instead, we have infections and clusters of people in close contact. The bell-shaped curve that people have seen numerous times assumes widespread contact and are not applicable to rigorous containment efforts. In contrast, the jagged sustained curve predicted by MetroHealth's model are based on network effect and contact limitations. The models were developed to help MetroHealth prepare for and respond to the COVID-19 epidemic in our community. The MetroHealth models show new infections in Cuyahoga County gradually increasing until around late April, followed by irregular outbreaks in clusters throughout the year. A similar pattern is expected statewide, with Ohio having significantly lower number of daily new infections than previously expected, and continuing at a flat rate throughout the remainder of the year. The importance of social distancing cannot be overstated. These models do not mean people can or should go back to life as normal. In fact, our models assume that people will continue to stay home if they have symptoms, frequently wash or disinfect their hands, not touch their face, and stay at least 6 feet apart when in public. If we were to become lax or immediately go back to numerous unprotected contacts, the bell-shaped surge would return. MetroHealth physicians and public health officials have already observed clusters of infections involving people who have attended funerals, after religious celebrations, in nursing homes, the county jail, and confined workspaces. A lower number of infections obviously results in fewer deaths and hospitalizations than unfettered community-wide infection. I credit Ohio's leadership on social distancing practices for lowering acute number of infections. I also believe the model should be viewed in context of the overall health of Cuyahoga County and Northeast Ohio. These models have serious policy implications and raise important questions about how to best provide healthcare to our community. If this scenario continues to play out over the next several months, one question we as healthcare leaders must address is, at what point should we resume preventive screenings such as mammograms, colonoscopies, and stress tests? We will need to provide healthcare treatment that is now being put on hold, while at the same time containing the spread of coronavirus. The state of Ohio ordered the cessation of elective surgeries and most preventive screenings in mid-March as a part of an effort to reduce the number of people coming into the hospital and potentially spreading the virus. That decision also helped preserve personal protective equipment and blunted the spread of coronavirus. It is too early for us to declare victory, but this is a signal that here in Northeast Ohio, we might be in a difficult, sustained campaign instead of a relatively short but intense war. We will need to figure out how best to care for our community, and we will continue to focus on providing the best care for our patients, our caregivers, and our community. I think the vigilance that we need to have in the future, and we've had in the past, is a great lesson for us to maintain the spread of the coronavirus. I'm happy to answer any questions for you.
So Dr. Atkin has been using the Ohio State model and also a model from Cleveland Clinic. Your model goes very much against this one, but at the same time, as they're calling for a large surge, yours is calling for a sustained, repeated surge throughout the year. Is your model based on just Cuyahoga County, or are you saying this could happen in the entire state?
So we developed the model for Cuyahoga County, and it is applicable to the state as well. I will say this to you, is that I think today the OSU model has been rerun. It will come out soon. I hope Dr. Atkin will show that. From the information I have, it will look a lot more like our model than the initial widespread model of transmission. Remember, we've never seen this before. We have never seen this type of quarantine in any time during any part of the history that anybody has ever seen. So we have social contacts that are reduced somewhere between 70 and 95%. That changes it from a pandemic model to a cluster and network model, which is what OSU is working on now, and I think what you will see when it comes out in the next day or so.
The importance of that information to the public, this does not mean that we can go back to normal, does it?
It is absolutely the opposite of that. It means we should not go back to normal. We need to maintain some social distancing. We need to continue with the hand hygiene. We need to continue to stay home when we're sick. We need to be isolated if we're suspected. All of those things need to continue to happen. The question is if this is going to be sustained over months, if this is going to continue on until a vaccine is developed, how do we go back to providing healthcare services? And what are the assumptions that we need to have, and what are the conditions we need to have to be able to safely care for people and contain the disease at the same time?
Is that something you're trying to figure out, or is that something you're already planning to do?
So I guess a bit of both. We are still trying to figure out. We have a rudimentary approach to it, but we want to listen to our public health experts and coordinate with them to be able to do do this at the right time and with the right approach.
The importance of getting people with chronic conditions treated now, because they have been putting off their health care for a month. Why is that so important?
So we have decades of studies that shows preventive measures, screenings for both cancers and colon cancer, heart disease, breast cancer saves lives. Managing diabetes aggressively saves lives. It also, by the way, saves lives if a person gets a coronavirus infection. Those who have treated and hypertension and cardiac disease and diabetes that are in stable condition fare better than those who have unmanaged conditions. So there's a push and there's a pull and tug here with these issues. If it was a short period of time, we can put things off. If it's going to be sustained, we need to figure out how to walk and chew gum at the same time.
Are you expecting some pushback from your model?
Every model has pushback. I think I feel fairly confident that if we maintain the current rules of conduct, that the model will pan out.
When do you think preventative care can begin again, based on your model? Well,
I hope for us to figure this out with with public health officials and start reintroducing normal healthcare services by the end of the month.
So the basis of this is that when the surge that we were expecting was supposed to be 210,000 people. That was the surge from Ohio State. They're admitting that their numbers are probably not going to be that high because of Ohioans taking this seriously and
Right.
sheltering at home. But what you're saying is that we're going to see peaks almost every month. And it looked like in your model, almost by the middle of every month, we're going to see something. Why is that?
Yeah, so my apologies. So that's an illustration of what could happen. You can go 2 months without a peak and then have another surge. What happens is that somebody introduces the infection to a contained group. Then we as public health officials and healthcare providers come in and try to contain all the contacts, right? Follow them through and do that. So the expectation is that there's going to be some gathering, some celebration. Somebody goes into a nursing home, somebody goes into a school, and then you have some kind of spread within a contained population, that it's not happening across the entire community. That's what the model illustrates, specifically about how high and when it happens. That's just an illustration. It could go a week, it can go 2 weeks, it can go a couple of months without a peak.
So what you're saying is we can't have weddings anytime soon, or religious services anytime soon, or, we have to continue doing what we're doing for the foreseeable future?
So I would say to you is that religious services may have to be done with masks on. Okay, so you may be able to get back to sitting next to somebody, but it's your family unit. There's a space, and there's another then another family unit. You don't have to be sheltered in place all the time as we reintroduce. When that happens and how it happens, I think is an important discussion that we need to have between healthcare provider and public health officials, which I am confident in the leadership of the governor and Dr. Atkin to help us figure out how to reintroduce ourselves back into society.
Is Ohio different from the rest of the country based on your model?
Ohio is different in really 3 ways. The first is that the governor and Dr. Atkin took decisive actions really early. And if you remember, we had the first press conference on coronavirus with them at MetroHealth to talk about what needed to happen. The second is that Ohioans have been really diligent about staying at home and following orders. And the third, and this may be one of those things that you think to yourself is not typically a good thing from a way of life, but we don't have major international traffic through our airports. So therefore, we did not have a lot of introduction of a large number of cases of coronavirus early on. Like New York has 3 major airports, LA has major airports, and Michigan, Detroit has major airports. And I would say to you, one of the criticisms that the governor and others took, which is about postponing the election. Michigan did not postpone the election. They had people come out, and I think you're seeing the result of Michigan having a significantly higher number of cases because they did not postpone the primary, and where you're seeing our numbers in Ohio significantly lower because we postponed the primary.
Your model seems on par with the University of Washington model. Is that where you based your facts and figures?
No, actually, we then the University of Washington model, just so you know, was very different than ours about 5 days ago. And now, if you look at it, they made some significant change to it and looks much more like ours when they made the change yesterday. So we've always been looking at this as if, most of the models look at 20% social distancing, 30% social distancing, 50% social distancing. At 95% social distancing or higher, there is no pandemic curve. It's only clusters. And how do you pass infection from one cluster to the next?
Where did your analysts get their information for this model? Was it through patients you were seeing at Metro or another source?
So we utilized the University of Pennsylvania model, and then we hired EY to help us refine it significantly and add the network information from clusters. And we made some strong assumptions about clusters. We made a strong assessments of social distancing, and that is what results in this causes the jagged sustained ledge, across the year.
Are you expecting Ohio State's model to eventually resemble what yours looks like?
I think by the end of this week, many of the models are going to coalesce to look fairly similar to ours.
And one other question, sort of off topic. Why do you think African Americans are testing higher in numbers than any other demographic relating to this virus?
Yeah, I am, Malcolm, I am not sure. There are a lot of myths around there that African Americans are immune from the disease. That is not true. I think people need to continue to manage their own behaviors on social distancing, irrespective of race or religion. And I think one of the worries I have is that there's a higher prevalence of hypertension, diabetes, and heart disease in the African American community in Cleveland and in the Latino community than it is in the white population. So therefore, we're going to have people that are more symptomatic and require more admissions and are going to get significantly more ill because of the underlying conditions, not just because of race.